I've seen people's bills that have been extremely high, and I've also seen people walk out of the hospital 7 days after the surgery and be like, well, that was nothing. But it really depends on how much your insurance pays for, what your problems are after or before the transplant. It really depends. Our financial coordinator can tell you. Yes.
Like I said in my introduction, when I I've been referred to for my doctor to be put on to go up to evaluation for the CPA. And of course, he told me about Heidi, and this was back on July the 22nd, 2015. I was just wondering, how do you have an idea of how long it would be before I hear from her? I mean, I think my doctor said I would at least hear from her probably in the middle of September.
So we try to call everybody back within a few days to get a call. The unfortunate problem is getting the records and getting the information. A lot of times what happens is doctors send us a lot of information, hundreds of pages of information, and then we have to weed through it. Sometimes they don't include telephone numbers. It happens. It happens all the time. They'll send us a ton of information about you. They just won't send us your phone number so we can call you. So once we kind of look through everything, then we'll give people a call. It's usually like she tries to call you within a week to 2 weeks. Now, scheduling can be also difficult because we have patients that are coming, 3 or 4 patients every week, 4 or 5 patients every week, coming to get into clinic spaces that are very limited.
Well, in my case, I mean, before I was diagnosed, like I say, I was really overweight. I mean, I was probably close to 200. And I just lost my appetite. And I wasn't eating. So, and I knew I was losing weight, so I could tell from the top of my leg. I mean, I lost like 60-some pounds. And I should have been gaining because I was eating like ice cream and cookies and everything.
But that's a sign.
But that's what I had read. That was a sign that you do lose weight.
So you were diagnosed, and then it had been how many months before you got referred?
Well, when it all started was I had a hypertension, and my stomach was up in my chest, above my diaphragm. Okay, well, my primary care physician at that time, which I only had for about a year. I mean, I've gone 60-some years without a primary care physician. I've never been sick over that. But he had said after that was repaired, I wasn't even on oxygen. I probably should have been. But even after that was repaired, I would be able to do 85%. Well, that was in November of 2013. By May of 2014, I went in and my oxygen level was 68%. I walked in that office because once I started settling down and they finally get around to seeing me, my oxygen level was back up to the 90s. But it's when I'm moving, it starts dropping. So when I, like I said, they had me walk, and that's what I told them they needed to do. And, by that time, that's when, not my doctor, because he wasn't there, put me on oxygen and prednisone at 40 milligrams. Well, I was bouncing off the wall. I mean, somebody that had never taken medicine before. and now he's weaned me down to, well, actually, he weaned me completely off. Then he sent me to a rheumatologist. And I'm seeing both of them. And I just went to Dr. Alpha Fowler for a second opinion on St. July. And he preferred me, he said, there's no use in doing a lung biopsy because you've got scarring of your lungs.
Yeah. So we work very closely with Dr. Fowler and the whole entire team at DCU. So, you're probably in the queue. Again, I don't do a lot of pre-transplant. I only do it when he's out of town or she's got 10 referrals in one day. So.
Well, the reason I'm asking about the phone call, and I don't think y'all would have done a phone call this way, but a few days after that appointment, I got a call, and it wasn't from somebody, it was just a recording, and it said, I thought they said Sharon T. Moses, and I answered no. Then they asked me another question. They said, can you take a message? And I said no. And then they said, can you call back? Well, after I got to thinking about it, I thought, well, I wonder that would have been UVA. And I thought, well, they wouldn't have done it that way. So
no, we would have asked for you and then said,
yeah, I mean, this was like a recording,
Nobody, you're not going to go recording from us if we're calling you for about lung transplant.
So that's what I was.
It's going to be a live person.
Curious.
Wanda had a question.
It was about the amount you mentioned for the cost. Is that like you're out of pocket with insurance?
No. That's the like the hospital bill.
It seemed low.
It's now that, like I said, that's just the surgical procedure.
Yeah.
That's not hospital, you know, the
Oh,
drugs.
that's the actual surgery.
That's the surgery and the bed that you lay in while you're recovering from surgery. That's not meds, that's not, you know, therapies, that's not me coming to talk to you, it's not all the other things.
Okay, but Google did, they said it was like $1 million for a double.
That's the end cost altogether.
Okay.
Yeah. And I mean, it's different. If you're there 6 days, it's one thing. If you're there 14 days, if you're there 21 days, it can be very high.
Okay, that's, thank you.
I just wanted to know what was the difference between UVA and INOVA?
What's the difference?
Yeah, like what,
We're in Charlottesville.
because I know that my doctor, for some reason, she referred me to INOVA versus UVA or I didn't know if there was some kind of.
So every center is a little bit different. We all have our kind of things that we do good. We all have things that we do bad. I like INOVA. I happen to think that Dr. Nathan is a great physician. Dr. Oksana is great. Meg Fergrosa, who I talk to on a regular basis, one of their NPs, great person. You know, it's just the difference. Some patients get referred to INOVA, some patients get referred to us. That's why I'm here today, is to kind of talk to you guys. So because we've heard that people are telling everyone that UVA lung transplant is closed. And I'm like, that can't be right. We need to get out there and tell them we're open. That's why.
I mean, I didn't even know there was.
Yeah, absolutely.
A lung transplant.
Did you know that you could be double listed at 2 centers?
No.
Absolutely.
Did you know what? Say that again?
You can be double listed at 2 centers at one time.
Exactly. And don't hesitate to do it.
Nope.
Remember, it's
Right
Follow
now,
each
no,
other's
It's your choice.
territory.
These are your
patient
choices.
choice.
Yeah, right now I'm good. I told them. Don't
If you're
listen.
stable,
I feel like I'm stable
Yeah.
and my quality of life is fine.
Perfect.
Don't listen.
yep. Other questions? All right, well, I want to thank you guys again for, you know, listening to me. I know I kind of ran.